All right, everyone, welcome back to our sensory assessment series. This is our final presentation in this. Part 4, we're talking about smell. Our objectives, same as they have been for the rest of this series. We're going to identify 2 ways that each of the following senses can influence the assessment of our patient, and we have gotten to smell. Now, if you want to hear about any of these other options here, sight, sound, or touch, feel free. The link to all of those videos should be in the description below. But today we're talking about smell. So, why are we talking about this? And this is something that I've talked quite a bit about in the first 2 videos, touched on it in the last one here. But we are able to gather so much information about a patient's condition before we even lay hands on that patient, just by utilizing our senses. Vital signs are fantastic, but they are points on a graph. They are there to help us trend, so we can't be completely reliant upon them. Right? All of this technology, there's always that potential for failure as well. So we need to be able to utilize our assessment skills and our senses in combination, in conjunction with one another, such that we can get a really good picture of kind of where this patient is in the grand scheme of life and where they are in their condition. So let's talk about smell. Smell can be done at a distance, though the further away I am and I can still smell them makes me a little bit more concerned, but here we are. This also can provide clues to the patient's condition. So there are a lot of diseases that you can smell, and if you've been doing this for a while, you can certainly pick out some of these smells. Some things that come to mind here, C. diff in particular, you're a nurse in the hospital, you can certainly pick that one out pretty quickly off someone, unfortunately. Pseudomonas, I'm thinking specifically my trach patients, though it is not restricted to only trach patients. Burn patients also may have issues with Pseudomonas. And diabetic ketoacidosis, you kind of have that fruity smell coming off the patient's breath. So these are kind of things that you can smell. This is not a completely compiled list. There are certainly other ones that I'm sure you can smell, but these are kind of a few big ones that jumped out at me. Additionally, we can talk about cleanliness. It's kind of a weird thing to talk about when you start talking about the cleanliness of a person, but it can give us so much information, just how they're dressed and how they appear and how they present to you. It can talk to us and tell us about the ability for the patient to care for themselves. The big kind of example that comes to mind, though certainly not the only one, the elderly population. So I'm looking at these vulnerable people, whether or not they have the ability to continue to care for themselves, and we really need to be their advocates as healthcare providers because they may not have anyone else. So looking at the cleanliness, are they physically able to care for themselves, or has something happened, there's a change in condition that has kind of caused them to temporarily be unable to care for themselves. So these are kind of things that we need to think about. Other vulnerable populations are those who are poor or impoverished. Things to kind of keep in the back of our head. It's kind of a sad thing to have to think about, but again, they're vulnerable. We need to be advocates for them. People who may not have enough money for both food and heat, or food and medications, or shelter and their water bill, stuff like that. So we need to really be able to advocate for these people and get them the resources that they need so that they can go on and live a healthy and safe life. Other things I like to think about when we talk about cleanliness are other new conditions. I'm thinking specifically about things like incontinence. So it's one thing for someone who is elderly or demented to maybe be incontinent, or especially if they have a UTI or something like that. So I can kind of get that, and that's also a smell. You can smell kind of urinary tract infections, been around them enough. But, are they urinating on themselves because of that? Or is it someone who's young and now they have this new incontinence? So I'm thinking someone who's like maybe in their 20s or their 30s, or, even in their 50s, it's not something that I would expect a patient to have a bout of incontinence. So do they have some sort of neurologic insult? Is one of the things that I'm thinking about here, whether that is a seizure or potentially even a spinal cord injury. So these are all things that we need to think about when we think about smells that come from our patients. So I'd like to thank you guys for joining me for my 4-part series. Again, the links to the rest of the series are below. Thank you for joining me, and I hope to talk to you guys again soon.